Also have.
We're in a moment right now. We're pushing forward to see different futures.
The seeds of those ideas that eventually become world-changing technologies really start with a desire that people have to have a positive impact.
The World Economic Forum Technology Pioneers is like a particle accelerator, and there's an opportunity for many of these particles to collide. And when this collision happens, it creates new inventions, new discoveries, and it creates new solutions that didn't previously exist.
We've taken about half of the world's population and brought them online, but the real opportunity is how do we bring the next 4 billion people online?
Technology allows access, and by having access, you're creating fairer level of competition, you're creating inclusiveness, and as you create inclusiveness, you make it less and less biased.
Education is absolutely necessary to bring the have-nots to the point that they can start to benefit. And so allowing people to learn throughout their lives is an incredible transformation.
While the world needs to farm at the scale of 7.7 billion people, technology now makes it possible for us to do that in a way that is healthier for the planet and healthier for people.
For climate change, it's really important to switch to renewable energies. But on top of that, we need to remove about 15 gigatons of CO2 from the atmosphere every year by mid of the century.
Ever more people are moving into the cities. Mobility is a huge challenge, and we offer a solution that is going to be a huge economic potential and will have a tremendous impact on how we move about our planet.
We've entered a reality whereby humans and algorithms are going to be making decisions together. And so if we are not careful to mitigate and remove bias in our algorithms, we will end up mimicking the human brain, which unfortunately has a built-in bias mechanism.
The way forward, especially in a post-COVID world, you have to be the kind of winning solution that creates winning for other people at the same time. How can we create an ecosystem that will replicate the best of who we are? And meeting individuals through Tech Pioneers has really solidified that.
We always trying to create the new innovations. Technologies should work for the human and the human society.
Hello, and welcome to the Pioneering Change Closing Plenary. My name is Mariette DiCristina. I'm Dean of Boston University's College of Communication in the USA. As the inaugural Pioneers of Change Summit is drawing to a close, I'm joined here on the virtual stage by 3 experts who are members of the steering group that produced the forum's annual Top 10 Emerging Technologies report. These experts can help us reflect on the role that innovators have to play in fostering systemic change and building a foundation for the future. Speakers joining me today are Daniel Hurtado, Associate Professor at Pontificia Universidad Católica de Chile in Chile. Daniel is also a World Economic Forum Young Scientist whose research includes developing personalized computational models of the human respiratory system. Hi there, Daniel.
Hi, Maria. Good to see you.
Good to see you too. Also joining us is Lee Sang-Yap, who is Distinguished Professor and Dean in the Department of Chemical and Biomedical Engineering in the Korea Advanced Institute of Science and Technology, known as KAIST, in the Republic of Korea. How nice to see you, Sang-Yap. Corey Lathan, Chair of the Board and Chief Executive Officer of Anthrotronics, a biomedical research, engineering, and development company, and also a leader in digital medical technology in the USA, and also a young global leader, is our third panelist. Welcome to you, Corey. So it's so great to have everyone. So during this summit, we've talked about the Great Reset, and we've talked about the things it will take to get us there. For instance, as we just heard in the video, that desire to have a positive impact. So tell us a bit about each of you, but I want to start with Sang-Yap, the 2020 Top 10 Emerging Technologies list, and how frontier technologies like that can help us address our global challenges. I know COVID, for instance, is on everybody's mind. Sang-Yap, let's start with you. I think you've been on the steering group since the very beginning.
Yeah, I think it was about 10 years ago. I had the privilege and the honor of serving as the chair of the Global Agenda Council on Emerging Technologies. And at the time, one of the key projects at our council was the selection of inaugural top 10 emerging technologies. And then we released the list right before Davos Forum, which later changed it to the release during the Summer Davos Forum. Now, obviously, the process for the selection of these top 10 emerging technologies has become much more systematic and advanced, thanks to the great leadership of our moderator, Mariette Di Cristina, and also Bernard Meyerson at IBM. This year's list is already 9th edition, can you believe it? Which means that we had selected 90 emerging technologies already. So before coming to this session, I went back to look at the previous list that have been selected, and I want to reflect on some of these emerging technologies. So I found the synthetic biology and metabolic engineering, which was selected in 2012, and the more advanced version called the systems metabolic engineering in 2016. These technologies are now increasingly used at biotech, pharmaceutical, and chemical companies, contributing to more efficient bio-based production of chemicals, fuels, materials, drugs, and even functional compounds. Also, I found the RNA-based therapeutics technology, which was selected in 2014 or so. Obviously, several small interfering RNAs and other RNA-based therapeutics have been approved by FDA and being used. We also may say that this technology, together with the genomic vaccines technology, selected a couple of years ago as a top 10 emerging technology, obviously contributed to the development of the recently announced RNA vaccines against COVID-19, we can say. We also selected the distributed manufacturing and precision genetic engineering about 5 years ago, which are notable. Distributed manufacturing, including 3D printing, is now all over the place with increasing usage. I fortunately attended one of the sessions during this summit that was a sustainable production session. And I was amazed to see very advanced distributed manufacturing technologies, including, for example, light-guided manufacturing, etc. Precision genetic engineering techniques are also being widely used for engineering microorganisms, plants, animals, and even humans. And for that, the key inventors of CRISPR system received the Nobel Prize this year. What about the others, such as blockchain, perovskite solar cell, autonomous vehicle? These are all selected about 4 or 5 years ago, and they are truly advancing rapidly, and we are seeing bigger potential in the near future, obviously. Lab-grown meat, selected in 2018, is already in the market with quite rapidly increasing market share. So this year's 9th edition, and it's equally, if not more exciting. So my colleagues, Corey and Daniel, will showcase some of these. So let me just list some of those I'm interested in. For example, microneedles for painless injection, sun-powered chemistry to convert carbon dioxide to chemicals using photocatalysts, electric aviation to obviously reduce aviation's impact on climate crisis, green hydrogen for clean hydrogen economy, and the one I wrote that was whole genome synthesis for developing advanced biological systems as cell factories and even therapeutic systems. So looking back all those previous lists and this year's list, the list of top 10 emerging technologies so far selected really demonstrate how technologies are making positive changes to our life, industry, and environment. For this reason, I might say that those people or us who have developed and are developing these emerging technologies are true pioneers of change. Thank you.
That's very nice, Sang-Yup. I'd like to then turn to Daniel, because I think, Daniel, also in the video, we heard about a post-COVID world, and Sang-Yup has just talked about some of the technologies that will help get us there. You wrote about one of them and certainly know about a number of others. Would you talk to us about that a bit?
Absolutely. Thank you, Maria. Yes, so in my case, I was in charge of writing about virtual patients. And I think virtual patients, they are very related to what we are living these days. It can be really a transformative technology for health development and for healthcare in general. So a virtual patient is a digital replica of a human, right? That it can be used to do experimentation, but on a virtual way, right? So a virtual patient in reality is a computer model that takes the geometry of a particular organ in a person, and this is a very patient-specific way, right? So we take images from magnetic resonance imaging, for example, and then you construct this organ, which can be a lung or it can be a heart. And then when you have that model, you can use the model to do some experimentation. For example, you may run a drug clinical trial, but virtually, so in silico, meaning you use the computer to predict what the outcome of this trial is going to be. Then you look at all the outcomes, and then you decide, well, the most critical cases are this and that. And with that, you actually have optimized the process of the clinical trial in order to reduce the number of actual experimentations on humans or in animals, for example. So that's the key concept behind the virtual patient. Now, the virtual patient is a technology that is currently being used to diagnose, for example, coronary artery disease. There are companies in the United States these days that take these images and transform those images in computational models of the coronaries in the heart. And based on these simulations, they are able to predict whether that coronary artery is clogged or is not clogged, or if it needs any, for example, therapy or not. So any procedure, for example, right? Thus avoiding, for example, things like catheterization or other risky procedures that are needed in order to assess the condition of that artery. So the virtual patients in general, what they do is really they offer to the clinician a computational tool to make better decisions about the diagnosis and the treatment for patients. Now, when it comes to coronavirus, for example, think about this. So if we have virtual patients, if we can run in silico or virtual clinical trials, can we accelerate, for example, the development of a vaccine? Well, that's exactly one of the goals that virtual patients can offer in the future if we develop also the immunology system and models related to that, right? So we can accelerate these clinical trials and we can improve also medical discovery by use of computational tools that can give you a model of the human body.
And you also were talking a little bit about digital medicine as another way. This is not quite exactly related to virtual patients, but somewhat connected in certain ways. Maybe you can speak about that a bit too.
Sure, absolutely. Well, it's not exactly connected. I think at some point they can be merged and they can, contribute to each other. But then when it comes to digital medicine, is the concept of using, for example, smartphones in order to diagnose diseases. And it's very much related to, this is like a psychological conditions, for example. So these days, smartphones and Siri and other systems, Alexa, they hear all you are saying, for example. So they can analyze your speech, and they can see whether, or they can try to relate that speech to certain moods, right? And those moods then can be classified into potential mental diseases, mental disorders, for example, right? So digital medicine is exactly that. It's using the current interfaces we have with computers and algorithms, which are based on smartphones or computers or any other control-assisted systems, right? That take the information that you are basically giving to them, analyzing that information and transforming that into a potential diagnosis. Now, digital medicine also relates to the use of, for example, smartphone or tablets in order to correct certain diseases. And one very interesting example is this application. There's an app for correcting the lazy eye. So basically, by using the cell phone and doing certain exercises with your cell phone, you can start correcting the lazy eye just by means of doing digital, medicine. So that's the concept of digital medicine.
Oh, thank you, Daniel. Corey, just thinking about our digital world, one of the, the item you wrote about this year with Jeff Lang was about spatial computing. Can you talk to us a bit about the technologies involved there?
Sure. Great to be with you all. So spatial computing is really the next step in this ongoing convergence of the physical and digital worlds. And, I've been part of the Emerging Technologies Council for some time as well. And what's been very exciting is to see some of the past technologies that we've covered really play into this. So, for example, several years ago, we covered open AI ecosystems, which is the concept of AI tools and platforms that will be available for anything from developing personal assistants to music, to the distribution of medicine and other things. And so these AI platforms have really enabled the integration of AI into so much of what we do. Another one that we've covered in the past is collaborative telepresence, which again is combining virtual reality and sensor technology like haptics, so that virtual gatherings can feel like we're more physically together. It's unfortunate that isn't farther along, but that is certainly a critical emerging technology. Spatial computing really does the same. It does the same thing that virtual reality and augmented reality do, but then so much more. So it digitizes objects. It connects them via the cloud. It allows sensors and motors to react to one another, but it also digitally represents the world, the spatial aspects of the world. So, for example, it combines high fidelity spatial mapping of an environment like a hospital, so that as you move through the hospital, your environment can react to you. So, one example is if a surgeon is trying to go from one area of the hospital to the other, the environment is reacting, optimizing their path to the emergency room, for example. You can imagine other more controlled settings like a home, where a home reacts to us as we age. A long time ago, we talked about smart homes, but spatial computing really is finally enabling that. And nowhere have we seen this accelerated more than in industrial settings, in industrial IoT, where now you have spatial maps of both the factory and the workers, and you can combine this high fidelity spatial mapping with the Internet of Things and robotics and AI and really optimize production. So that's spatial computing. I think there's I think it's really exciting to see these technologies come together. Some of the other technologies that we've covered in the past that I think are also very relevant now, social robotics, social robots, machines that are designed specifically to interact with humans as well as other machines. Another one that I think from last year that's very exciting to me is electroceuticals. So as we see the rising costs of pharmaceuticals, so treating pharmaceuticals, treating ourselves with chemicals and drugs, using our neural circuits. Humans are also a combination of neural circuits. And so treating our neural circuits for medicine is another emerging technology, I think, from last year that is very exciting and has seen acceleration during the pandemic.
Yeah, thank you. Corey, I'd like to stick with you for a minute. Obviously, the technology's development is just not enough by itself. We might have the positive intention and try to get to the better world, the post-COVID world or other world. Although I just had when you were talking, a flash of thinking of what if we had a World Economic Forum meeting with social robots and using spatial computing to have more virtual presence there. That would be really, really cool. But what are some of the other things we need to keep in mind, the folks who are pioneering change, so that we can be as successful as possible in actually bringing these to reality?
Well, I think the often used phrase that has been attributed to many people, but my version of it, the best way to predict the future is to create it. So we are all active participants in this, and particularly as an inventor, I've using these technologies as a tool or ally in the battle against some global issues that we're facing. So I think remembering that technology is a tool and we decide how to use it, and that it's intentional. When we talk about when we talk about the impact of technology, we have to talk about how to close the digital divide, not increase it. And I think that there's some great examples of this. Usually as an inventor, I'm pushing technology as far as it can go, but the need for that technology might be a nice to have, not a critical need. And telemedicine is a great example of this. Telemedicine technology has been around for decades. But it was a nice to have to not have to go to the doctor's office for most of us. I mean, certainly that's not true in all situations. But now with the pandemic, the scale of need has grown. And I think it's so important for us to recognize that the scale can really drive technology acquisition and policy and implementation. And as technologists, it's incumbent upon all of us to think about and again, thinking of telemedicine, the whole patient journey. It's not enough to just implement now the technology to bring the doctor visit to your home. We also have to think about, does that person have food security? Do they have food distribution? Do they have, can they get the medicines? So I think that it's not just now implementing the technology because the need is finally at a scale where it's possible to implement it. We have to think about the whole person, the whole journey, the whole ecosystem of that person. And that's going to be a real challenge. But I think we're up to it.
Thank you, Corey. And Sanyap, I know at KAIST you all really excel at, taking innovation and bringing it to application. Can you reflect a little bit on some of the things that technology needs to succeed to help us get to that better future?
Yes, I think one of the important things is true collaboration. I mean, we cannot more emphasize the importance of collaboration. Let me show an example of having great technologies, but how collaboration lead to address some of the most important problems in this particular time, COVID-19 pandemic. So it is still going on, and in fact might become worse during this coming winter, unfortunately. So again, science and engineering should contribute to overcoming this unprecedented situation. So at KAIST, we are running a program, so-called COVID-19 New Deal project, which is supported by the Ministry of Science and ICT. So when a number of patients sharply increases, like we are observing now, obviously the hospital beds will be quickly packed, causing healthcare disaster. So such potential disaster prompted us to develop mobile clinic module, which is basically negative pressurized bed clinic that is readily producible, installable, and transportable. So it can be, even exported to the country who need. We also use advanced IT which is dependent on GPS and also other signals such as Wi-Fi to locate so-called corona hotspots so that people can use their mobile phones to avoid the risky places and also learn where they had been safe. Another example is mask. I mean, wearing mask obviously is of course one of the best strategies to prevent infection. And people around the world throw away staggering 129 billion masks per month. And as you know, most of these masks are made of polypropylene, which is non-degradable plastic. And obviously throwing that many masks per month is causing another big problem of piling up waste plastics. So KAIST has developed 3 types of masks which can be combined too. Washable mask using nanofibers made. So obviously this mask filters viruses rather than catching them through a static mechanism. Also biodegradable polymers can be used if needed. Also you can apply natural product-based human-friendly yet virus-killing chemicals on the mask. So instead of just capturing or filtering mask, you actually actively kill the viruses by wearing the mask. Rapid drug repurposing, aided by advanced computer docking simulation and artificial intelligence, is also a good example because COVID-19, unfortunately, might not be the last pandemic. So if such emerging viruses attack us, we can quickly develop the drug candidates, for example, within 1 week or less than a week, so that people can be, addressing all these, dangerous viruses. So I think all these works required one very important component. Yes, emerging technologies, different expertise are all great, but only when they collaborate, all these, technologies can be put together to solve big problems like COVID-19.
Thank you, Sang-Yao. I'm going to change tracks a bit because I'm delighted to see there's a few questions in the Q&A and want to give our audience a chance to ask a couple of things. This first question is for Daniel. It says, can you do clinical trials with different populations according to their specifics? Can this be modeled in your virtual patient model as well? So, in other words, can you tailor the virtual patients to different folks?
Yeah, no, absolutely. I think virtual patients are also related to precision medicine from the perspective that you are using computational models that are built from the information that you get from a particular patient. So that means you can also consider differences that may arise due to gender, for example, to genetics, to and some other conditions, And this is something that computational models are looking to incorporate, right? So remember that this is still a ongoing technology, is being developed, but this difference, of course, can be incorporated into virtual patients.
Thank you, Daniel. And then we have another question, which I guess we could all speak to. And I see you've gotten a thanks from the audience member. Thank you, sir. Which is one of the things that the quarantine showed is the importance of human contact. What can these pioneering technologies? How can these pioneering technologies work together to improve social contact? Corey, this one seems like a natural for you to start with, if that's okay.
Yeah, I think it goes back to what I alluded to before, this concept of the patient journey or the person's journey, not just a patient, that really understanding the whole ecosystem around the person. Can we use AI to identify vulnerable populations, maybe where single mothers are trying to work and deal with their children on virtual education and access the internet. So can we use things like AI to actually find these vulnerable populations, and so we can target the staff that we have, which is already reduced. So I think just the scale, we have to really scale from 1-to-1 to 1-to-many, but we need to do it in a really smart way. So I think that's one example where that can help. I think, I talked a little bit about collaborative telepresence. Zoom obviously is not it doesn't replace seeing someone in person, but you know, being able to visit your loved one in an assisted living facility or a nursing home, I mean, those things have been really shut down, and for good reason. So even things like video conferencing, it may seem a really tired old technology for us. It's actually kind of an innovative and new technology when we talk about connecting with family and loved ones who are in vulnerable situations and really can't have that person-to-person contact. But it's certainly better than what we have. So, I mean, those are just two examples, and I think there's probably many more that others have.
Thank you. So we have just a few minutes left, and I do want to ask at least one other question. This meeting's raised quite a number of insights over a really fascinating week. For me, one of them was in a session earlier in the week on cyber threats. I was really just amazed by the AI used to make a deep fake of Troels Erting-Jorgensen, the chairman of the advisory board for the Center for Cybersecurity Global Challenges. And the global challenges like that kind of engagement, but not knowing whether you can trust the platform. So if we are more socially connected by technologies like this, but don't know if we can trust it or not. I mean, as a science journalist, my whole career, and thinking that really renewed a passion for me to work toward communication that can be authoritative and trustworthy, so we can all understand each other and get to that better world. I'm just asking the panelists, is there a highlight from the meeting for you? Feel free to. Daniel's got his hand up. Why don't you go first, Daniel?
Sure. Thank you, Mariette. Yes, I think it was in the opening that Christina Lagarde was mentioning the importance of startups, technological startups that can also help to come up with solutions for this COVID-19 pandemic. I think startups and in general, small companies, they have the advantage of moving very quickly and to adapting. And also, I think they do have a very key role in coming up with emerging technologies, which is also the integration of existing technologies. So, for example, we have talked about the top 10 technologies here, but you may think, well, I mean, these technologies are now mature, have been developed, but how can we integrate these technologies together? And this is a role that sometimes may be very hard to work on if you are in academia, right? Because I mean, you're of course looking for groundbreaking technologies that are more closely to the scientific part and not so much to the application itself. So that's where I see a high value on startups, and therefore some of the comments that I heard about putting more funding into these small companies, it's extremely important these days of the pandemic.
Thank you.
I'll say a quick one.
Yeah, thank you, Corey.
Yeah, a part of the Frontier Technology session yesterday, I was really happy to see that we've stopped using AI as this sort of monolithic technology that will either solve all our problems or cause all our problems. And instead, we're really talking about it in context, in integrated context of solving problems like predictive analytics to reduce waste and improve distribution, manufacturing and distribution. So I like that this idea of integration, I mean, that came up again and again in examples where AI is, I think, where it's always belonged, which is as a tool integrated in the problem we're trying to solve.
Thank you. I see we actually have got a couple more questions from the audience, and I'd like to ask one of them and see if we can fit it in. We have 3 more minutes. I think we might be able to. This one is a very telling one. In COVID-19 times, we see many egoistic countries focused activities, such as, they just want to ensure vaccination doses for their own population. How can we have a more global view and deliver technologies and vaccinations and things like that to those who really need them, instead of just to those who can afford them? Anyone like to touch on that? Sang-Hyop, would you've had so many experiences with lots of them. I wonder if you've seen things that work to help to do
that. Unfortunately, I do not have answer to that. But you know that there's an international activity of securing these vaccines for proper and the right distribution. But of course, there are some countries who are more into their own countries, which is causing a problem. But I think in general, humanity is still alive. So I'm sure that, of course, we have to produce enough number of vaccines to give to enough number of people to start with. But once it's done, obviously it can be distributed. But for now, I think the vaccines will be given to those more vulnerable, and of course, those people who are working in the healthcare system so that they can protect us. So I think we need a better political and agreeable system. But in general, I think humanity is alive, I think.
Thank you. So I think we just have about a minute to go, and maybe it's time for me to wrap up. I just want to, first of all, thank our panelists so much for their insights. I mean, we've heard about the top 10 emerging technologies for this year, but also prior ones and ways to help support them. Some of the themes we need to keep in mind are collaboration, which I think the forum is, I'm so grateful to the forum for doing that, bringing minds together who can help identify possible collaborations, who can work to integrate existing technologies and create those better systems and inspire us all by, bringing each other together. And I'd like to kind of quote a couple of things I heard Corey say, actually, that, the best way to create the future, the best way to predict the future is to create it. I think it's in our hands to help do that. And technologies can be our tool and ally in how we decide to do that. And the last thing you said, Corey, was that we're up for it. I feel that way as well. I want to thank our panelists so much and thank the audience as well. Now back to the forum studio.
Thank you very much, Mariette, and thank you for having taken such a leading role in making this approach and the 10 technologies reality over quite a number of years. And thank you, Professor Lee and Daniel and Corey. It was a fascinating discussion, I have to say. I'm an engineer, and technology was always close to my heart. I take out of this discussion a number of points. When I wrote the book and I coined this notion of the fourth industrial revolution, I had one sentence, and I think it was the key sentence which was most quoted, saying that the fourth industrial revolution will bring us a fusion, or at least an interaction, of our physical, our digital, and our biological identity. And it was very interesting. Of course, this sentence is now, when you go to the conspiracy people, it's very often used as a means to master the world. But I think the technologies you have presented are very much a reflection of this notion of the fusion of our physical, biological, and digital identity. And of course, it will need a great effort and to make those technology really human-centered and to show that they are serving society to be accepted by the large public. The second point I want to take, I want to highlight is, and it's interconnected, we need a system approach when dealing with the new technologies. It's only the synergy which makes them really effective. And I want to mention here one of the activities the forum is particularly proud of, which is uplink, because the role of startups has been mentioned. So based on a strategic cooperation agreement which we have signed with the UN, we have built a technology platform called uplink to engage startups behind the SDGs. For example, we have collected ideas for how to clean up the oceans, and it is quite a considerable success, because those startups usually do not know how to bring their technologies to global attention. One last comment I want to make in the context of the discussion is the issue of video conferencing. What can we do with video conferencing? It's a new technology, and I think we can very well transmit information, knowledge, maybe even with some artificial intelligence perceptions. But video conferencing is not a good tool to establish trust. So our philosophy at the Forum is to combine the tool, to use the best dimensions of digital interaction and physical interaction. And I hope to see all our tech pioneers and our at our next annual meeting for the new champions, which let's hope that the vaccines do their work, which will take place, which is planned for next autumn. I cannot yet share where and when. I think it depends very much of the development of the COVID pandemic over the next months. Finally, you are pioneers of change, and I would call myself also a pioneer of change, not of technological change, but of societal change. And society never has been so much in need to, I wouldn't say to be transformed, but to transform itself, to adapt to all those new developments which we have, the pandemic, the lack of international cooperation. So the Forum has started this great reset initiative. You may have seen I published a book, which I have to say with some pride, it has been a bestseller on Google, on Amazon since weeks. The idea is that we have to work together to make the world more resilient. I think resiliency is a new dimension which comes in. And of course, we have to make the world more inclusive, but also fairer. And finally, we have to make it more sustainable. So we are working on a number of initiatives in those areas. We will have at the end of January, we will have our Davos Action Week, which will be virtual, where we will try to create an integrated concept for what has to be done in collaborative efforts. And then we may, and hopefully we will, meet physically for what we call the Davos meeting, but it will not take place in Davos. We will meet in May. What I want to communicate is the Forum is, as you know, an international organization officially for public-private cooperation, but in reality, we are a collaborative platform for all walks of life. And we put great emphasis to bring into the thinking of today those new technologies, the new developments. We want to be really forward-oriented. And that's what the world needs, because if I look at our discussion today, and I would invite, let's say, the decision makers, not necessarily the heads of tech companies, but the decision makers, most would have no clue about what we are talking about, despite the fact that it will have a great impact on the world, and it has a great potential to solve all the issues we are confronting. So let me conclude by saying again how proud I am of the different communities we have established, and how much I look forward to continue to have you integrated, but not only to have you integrated, but you have you very actively engaged. So thank you, and back to you, Christoph. Stefan, you have been in charge, and you have been responsible for this meeting, and you are also responsible for the pioneers. And I think you and your team deserve a great thank you for having run this meeting, but again, also a great thank you for the panelists for our final session.
Thank you very much, Professor Schwab. Thank you to Mariette and the panel, not only for this fascinating conclusion of what has been such an action-packed week of innovations and innovators, where we sought to put the spotlight on the people, the organizations, the companies that are really working on these solutions that may help us contribute to a positive Great Reset. Thank you very much for your engagement over the years with this work on emerging technologies that has been so foundational for what we do. And so now it's my absolute pleasure to bring this first Pioneers of Change virtual summit to a close by bringing in a very special cultural leader who has been with us in person at the beginning of the year when we were closing our 50th annual meeting in Davos with a special closing performance. Harry Yeff is a vocal artist, but he's also an innovator who is using technology to show us a digital twin of ourselves and convey this reflection that we had today about the role of technology in a way that only art and culture can do. So with that, thank you all for your engagement throughout this week, and please enjoy the closing performance by Harry Yeff. Harry, over to you.
Thank you, Stefan. My name is Harry Yeff, and I'm here to present a piece of work called Second Self. When I was growing up, I was a tournament chess player, and I had a deep fondness with how these artificial systems were an opponent, a mentor, and collaborator simultaneously. My opponents were my greatest collaborators. We can interact with artificial intelligence, not to just understand the world around us, but to better understand ourselves and the very idea of what it means to be an expert. Expertise is in question, and we have to represent how we can work with technology, augment with technology in brand new ways. And more importantly, create the stories, experiences, artworks, and installations that help wider audiences understand the breadth of that potential. The piece you're about to see, I train and sing and perform with an artificial second self. This interaction allowed me to perform, have insights into my expertise in brand new ways. But the aim is to help us understand that this can be done in any form of expertise. Thank you for listening, and I hope you enjoy Second Self.
One, two, three, four, five. One, two, three, four, five.
Enough for a piece of rosen. As is and for with VDM and this exploration just